All right, let's look at the bones surrounding the spinal column, including the base of the skull all the way down to our coccyx. So first, the lumbar vertebra. You can view the lumbar vertebra as kind of a general, the typical vertebra. So all features on the lumbar vertebra are shared by thoracic and cervical vertebra. So anteriorly, we have the vertebral body. Posteriorly, we have something called the vertebral arch. So you can see it kind of creates an arch um, covering the spinal cord, which goes through the vertebral foramen. So the vertebral foramen is the large hole between, between the vertebral body and the posterior arch. Again, the spinal cord passes through there. We have the pedicle, which are the pieces of bone that jut out posteriorly from the vertebral body. We have the lamina, which are pieces of bone that unite to form the spinous process, which is posterior, that you can actually palpate along the posterior part of your body. And then we have the transverse processes, and the transverse processes are a uniting of the pedicle and the lamina. And then we'll see the articular processes, superior and inferior, on a different view. All right, so a sagittal view of the lumbar vertebra. So we're looking from the side. Here's the vertebral body anteriorly, and here are the parts of the vertebral arch posteriorly. The superior articular facet is here in green. The inferior articular facet is in purple. And these kind of interlock like Legos to keep the spine oriented, not sliding in a translational motion, anterior and posterior, or medial and lateral. The red dot on here shows the intervertebral foramen. The intervertebral foramen is actually not an anatomical structure. It only occurs or appears when you have two vertebral vertebra stacked on top of each other. So you have one vertebral body up here in the superior aspect, one vertebral body inferior, and it forms this between vertebral foramen. And that's where our nerve roots exit. And that's if foramen or hole becomes smaller, that's where you can impinge or pinch, quote unquote, a nerve, that you will have some problems or referred pain, maybe down your leg, say. All right, let's look at the cervical vertebra. You should notice it's much smaller and it has a few other foramens outside of the vertebral foramen. So let's look at the specifics. One key difference between the cervical vertebra and the typical lumbar is it has its spinous process. So this is posterior, has a bifid tip or two tips on the spinous process. It also has costal processes, which are on the lateral side. Here you have the transverse foramen, which are holes, if you will, in the transverse processes. And that's where some blood vessels go through. Looking specifically, the first cervical vertebra we call the atlas. So I believe it's Greek mythology. Atlas held up the world. So the atlas vertebra, C1, holds up your skull. We have vertebral arches, anterior arch and posterior arch. We have anterior and posterior tubercles, so there'll be little bits of bone jutting out anteriorly and posteriorly on this cervical, the C1. And we have articular facets. The articular facets articulate with the base of the skull. All right, we have C2, which we call the axis, because you can't see it in this view, but this center piece goes up inferiorly, or sorry, superiorly, and articulates here on the atlas. It's called the odontoid process, or the dens. So the dens is basically the vertebral body of the C1 atlas. We also have a transverse ligament that holds the dens in place when it's articulating with C1. And now looking at thoracic vertebra, they have a few features that separate them from cervical and the lumbar spine, or the lumbar vertebra. We have superior and inferior demifacets. So they're little articular processes, and they're demi because they're half, because the ribs articulate between two thoracic vertebra. So each vertebra has two demifacets. The vertebra below, say this one, would have another demifacet, and the rib would articulate, the head of the rib would articulate here. You have transverse costal facets. Again, the ribs are curved, so the head of the rib starts in the vertebral body, and then it curves around and hits the transverse process. And you can see this best on a full skeleton. We also have a spinous process that's long and kind of angled inferiorly. All right, the sacrum, which is at below the lumbar vertebra, are 5 fused vertebrae, so it becomes one bone. We have the anterior view on the left, posterior view on the right. We have the apex of the sacrum, which is the bottom point. We have the base, which is the top, and the base of the sacrum articulates with L5. So when you put L5 on top of the base of the sacrum, that becomes the joint L5S1. We have articular processes that articulate with L5. We have the sacral canal, which is where the part of the spinal cord starts to continue to pass through. We have the median sacral crest, which is basically all the spinous processes of these fused vertebra. And then we have the lateral sacral crests. So these are the transverse processes that merge together on either side of the median sacral crest. And then we have all these sacral foramina, where nerve roots leave the sacrum and travel down to our lower limb to innervate all the muscles that we're learning there. All right, the ribs. So here's an anterior view of the ribs, posterior view, so you can see our vertebra. Vertebral sternal, those are the true ribs that come from the sternum to the vertebra. These ribs directly connect to the sternal body. And here's the body of the sternum, which we'll see a little bit later. So there's 7 pair of true ribs. So we have 5, 6, 7 numbered on the anterior view. And then we have the vertebral chondral, which are also called false rib. And there's 3 pair, and these ribs have a common connection to the sternal body. So you can see here, they come up, this is all cartilage, and they come together and then attach to the sternal body. So there's 3 of those. And then we have the floating ribs, which you can see best on the posterior view. There's 2 pair. These ribs have no connection to the sternum, and they protect the kidneys. So you can see your kidney here, and you have 2 floating ribs. All right, let's look at the sternum. So the sternum, quote unquote, your breastplate, so you can palpate it if you push on your chest anteriorly. The top of your sternum is called the manubrium, and it has the sternal or the jugular notch at the top that you can palpate. You have the body of your sternum, which is kind of mid-chest, and then you have this little piece of bone hanging off called the xiphoid process sometimes people can get that broken off, which can cause some damage.